The Frere Hospital in the Eastern Cape has been allegedly ordered to close over concerns about its measure to stop the spread of the coronavirus. Health and safety inspectors from the Labour Department say efforts by the hospital to curb COVID-19 are inadequate. The matter is set to be heard in court as the Department of Health has lodged an urgent court interdict to challenge the notice issued by Labour officials. Meanwhile, Bisho hospitals have been closed after a nurse died and some of her colleagues tested positive for COVID-19. Joining me on the line is the HOD of the Eastern Cape Health Department, Dr. Tobile Mbengashe. Dr. Mbengashe, welcome to the program.
Good afternoon to you and to your viewers.
If you can just firstly take us through what the inspectors have found.
Well, I think we were very surprised about the notice of prohibition from the inspectors. And the reason why that is so is that we, as a sector, have been really engaged in what is called the personal protection equipment of our employees, and then the provision of the safety measures to make sure that there is no transmission. And then we have also been working very hard in re-engineering our hospitals to make sure that there is much more heightened interventions for prevention of infections. So when we received this notice of prohibition on the 18th, we actually raised it with them that, of course, we are very, want to make sure that we are compliant with the office, with the occupational health and safety, but the manner in which the prohibition is provided is literally vague, and it does not really specify what's required. What we believe as our responsibility is that the provisioning of masks, the provision of sanitizers, and the checking of people who are coming to the hospital in terms of symptoms and triaging those people is some of the measures that we do. Obviously, from where we sit, we are strictly following the factor, WHO, and other international best practices of actually preventing an infection. So we felt that maybe the prohibition is probably misdirected, and therefore we try to open up the conversation between ourselves and the Labour Department to try and see whether those things that they feel needs to be corrected, we can be provided time to actually to do so. Unfortunately, they would not accede to that, and we were left with no choices to protect our patients and make sure that we're continuing to provide services in the hospital. And that's the reason we've gone for an interdict.
And looking at this particular facility, the inspectors have said that the health and safety measures which are already in place are inadequate. What's your response to this?
Well, we think the measures are adequate. Obviously, we're very keen to make any improvements, and we're always open to that. And the reason why that is true is that we have established the occupational health and safety committees, which is part of the regulation and the requirement. Everyone who comes to our hospital is going through a triad system where it's assessed the symptoms so that they can be directed where they need to go. All our staff in our hospitals are wearing masks, and sanitizers are available everywhere. And, because we are primarily a place for where infection control is done as routine, and it's not something that, we learn from somewhere. As the COVID came over, has become an additional responsibility for us. We have been working with this personal protective equipment and making sure that we have engineered our hospital. Our administration is targeted in making sure we're minimizing an infection, and our teams are actually trained and make sure that they understand, the mask, the social distancing, and washing of hands. So we think in the manner how this is done, and the insensitivities in relation to the needs of the communities in terms of the patients, while I understand that we need to provide our workers with the safety, but also we've got the huge responsibilities of the hospital. And of course, this is totally infeasible. You can't remove over people with 800 beds and you just put them on the street because of the prohibition. So we feel that this is a matter that could have been easily resolved, talked about, discussed, and we actually quite ready to implement whatever is required within the reasonable means that we have.
So it looks like we are now set for a legal showdown between the Health Department as well as the Department of Labour. Are you in any position to give us an idea of what you'll be arguing in court?
No, we can't do that, but what we hope for is that by Monday, we are expecting that Labour will formally respond to our request that they should rescind the prohibition, failure with which we will take the matter to court. I think the general point is that, there are major constitutional requirements for us to provide safety and treatment and access to our patients. We think that is our primary mandate. We have made provisions to provide personal protection and equipment to all our workers, including visitors to our hospitals. We think those two aspects and the ability for us to continually make sure that we are fighting the COVID, and as we are challenged by the COVID, is a reasonable thing that we're doing. So, but anyone who actually has some other matters, we're quite open to look into those and actually that there for look. But we would need to be given time to do so, and we don't have time. They just decided to prohibit, the place, and there was no consideration of what happens to the nurses, what happens to the patient, what happens to people who are in ICU, what happens to people who are actually cancer treatment, what happens to all these other people who are sick in hospital. And so I had no other option other than to protect my patients.
And do you have a plan for the patients as well as staff at the facility?
Well, we think that we have reasonable measures for safety of both of the patients and the workers, and we think that the courts will actually make a determination about what reasonable measures we need to put in and what reasonable time we are required to do those. And I don't think that any court would ask us to put patients on the road.
And just give us an overview of the province's response to stop the spread of COVID-19 and just an idea of the numbers at this stage.
I think our response, as you know, that we actually presented our plan to the President and the Minister about a week ago, and we are part of the broader, public health intervention, which we had to do in relation to our strategy to fight the COVID. We were part of the lockdown, and we think the lockdown has worked in trying to provide the healthcare services a space to breathe and to prepare and be ready for the major surge within the infections. We are really adopting a clear strategy of making sure that we're reducing the transmission, and we are in that social distance, washing our hands, and making sure that people are tested and isolated and providing quarantine. That work is ongoing. And the second part is that we have actually geared ourselves, made ourselves ready for a high number of people. We are going to be building building field hospitals. We have repurposed our beds, and we are putting more people into our services. And just on the isolation, our estimate that we have to build about 8,000 beds. In Kenya alone, we're going to build about 4,000 beds. And so we are making great provision for us to be responsive when the problem actually hits at the height of the epidemic.
All right. And just lastly, if you may just give us an update about the Cuban doctors that arrived in the province a few days ago.
Yes, we received about 20 what's called Cuban Brigade, and this is part of a national program to strengthen the hotspots, that is Nelson Mandela Bay, and that is Buffalo City and Crisani. Of those 20, each one of these areas will get about 4 specialists plus epidemiologists, and then we're also putting up additional community health workers to make sure that we're doing the targeted tracing and contact and isolation of patients. We think that when South Africans look at these numbers, they must actually look at them as actually a period in time where the curve is. For instance, Western Cape numbers are no different from other numbers in other provinces, other than that the epidemic has been earlier in Western Cape and is probably coming. Other provinces are later early in the epidemic. So our approach is that we continually say it is not that we want to stop all new infections, but we really want to slow down, because the tools to stop all new infections will be a vaccine, herd immunities, or a treatment that actually suppresses the virus. So our approach is slow down the virus, give the healthcare facilities capacities to respond, make sure that you don't get overloaded, and make sure that you fight where the hotspots are, make sure that people are adhering to the basic ways of stopping the infections amongst themselves.
Dr. Tobile Mbangashe, there, the HOD in the Eastern Cape Health Department, telling us about it. The Frere Hospital in the Eastern Cape having been ordered to close down by officials at the Labour Department.